So you want to understand diabetes right, like really get it, not just the surface stuff. We're talking what it is, the impact, and how it relates to you.
Exactly.
And lucky for you, we've got just the thing.
We do. We're diving deep into understanding diabetes mellitus. It's a pretty comprehensive guide, and we're going to pull out the most important info.
By the end of this, you'll have the basics down pat.
And maybe even a few surprises along the way.
So let's get right to it.
Sounds good.
What exactly is diabetes?
At its core, diabetes is all about how your body handles blood sugar. We call that glucose.
Okay, so glucose, that's the fuel our cells need.
Right. It's like the energy source for your body.
And insulin.
Insulin is like the key.
It unlocks the cells to let the glucose in.
Precisely. It's the delivery system.
Got it. So in diabetes, that delivery system is messed up somehow, right?
Exactly. Either your body isn't producing enough insulin, those delivery trucks as we called them,
Or
or the cells themselves become resistant to insulin. They're like, nah, we don't need that fuel, even though they do.
so the glucose can't get in.
And that leads to high blood sugar.
And that's where type 1 and type 2 come in.
Exactly.
But they have totally different roots.
They do indeed. Type 1 diabetes often shows up younger, and it's an autoimmune disease. Like, the body's defense system goes haywire.
And attacks what exactly?
The insulin-producing cells in the pancreas mistakes them for the enemy, basically.
So no insulin production at all.
That's the problem with type 1. Now, type 2, that's the one we see most often.
And it's a slower burn, right? Develops over time.
Yes. It's not a lack of insulin at first. It's that the body cells just stop responding to it well.
Like they've built up a tolerance.
In a way, yes. Sometimes the pancreas can't keep up with the demand either.
So overworked pancreas, resistant cells.
Yeah.
Got it. So what causes these different types in the first place?
Let's start with type 1. The exact cause, we're still figuring that out.
But genetics are definitely involved.
Big time. Family history is a major risk factor. And some research points to viral infections as a potential trigger.
For those who are genetically predisposed,
Yeah, you could think of it that way. Type 2 diabetes is a little more complex.
more factors at play.
Absolutely. Lifestyle choices like obesity and being inactive, those are big contributors.
If you're carrying extra weight, your body needs more insulin to process glucose, right?
Right,
Puts a strain on the pancreas.
right. And a diet packed with processed foods, sugary drinks, and unhealthy fats that fuels insulin resistance.
All those cells putting up the no vacancy sign.
Exactly. It all adds up.
So how would someone know if they might be developing diabetes? What are the warning signs to watch out for?
There are some common symptoms shared by both types. Feeling
Uh-huh.
super thirsty, peeing a lot, especially at night, unexplained weight loss,
So,
constant fatigue. But these can be subtle.
and easy to miss, especially early on.
Exactly. Now, for type 1, it often hits pretty suddenly.
Any telltale signs for that?
Fruity smelling breath, that's a red flag.
Oh, wow, okay. What about type 2? Trickier to catch since it's more gradual.
It can be. The symptoms can creep up over years.
People might brush them off.
As just part of getting older, yeah. But there are some specific signs.
Such as?
Tingling, numbness, or pain in the hands and feet.
That's the neuropathy we hear about.
That's it. And then there are darkened skin patches.
Where do those usually show up?
Usually around the neck or armpits. It's called acanthosis nigricans.
So what's going on in the body to cause those specific changes?
Great question. Neuropathy, that's the high blood sugar damaging the nerves, messes with their signaling.
And with acanthosis nigricans.
The exact cause, we're still not 100% sure.
But it's likely linked to insulin resistance.
That's the leading theory.
It's incredible how the body signals these underlying issues.
It is.
But it's important to remember these are just potential red flags, right?
Yeah.
You need a doctor for a real diagnosis.
Couldn't agree more. Self-diagnosing is never a good idea, especially with something as complex as diabetes.
So how does a doctor actually diagnose diabetes? That's a good question to unpack next time.
Definitely. There are a few key tests that give a clear picture.
Sounds like a good place to pick up in part 2.
I agree. See you again. So those tests I mentioned, they really help us understand what's happening with blood sugar control.
So it's more than just a simple blood sugar check.
Right. It's not just one snapshot. We use a few different tests to get the full picture.
Okay, so what are we talking about here?
Well, the big three are blood glucose tests, the hemoglobin A1C test, and then the oral glucose tolerance test.
Let's break those down. I've heard of blood glucose tests, of course. They measure how much glucose is in your blood, right? But I'm guessing there are different types?
You got it. There are a few different types, and each one tells us something a little different. We've got the random blood sugar test, which, like the name says, can be done anytime. Doesn't matter when you last ate.
And that just gives a general idea.
It can raise a red flag right away if the numbers are really high, like 200 milligrams per deciliter or higher.
Okay, and what about the fasting blood sugar test? That's the one where you can't eat before, right?
Exactly. No food or drinks except water for at least 8 hours before the test.
So no coffee before this one.
Nope. We need that baseline measurement after fasting.
What's considered a normal level there?
Less than 100 milligrams per deciliter is generally considered normal.
And what if it's higher than that?
If it's 126 milligrams per deciliter or higher, and we see that on 2 separate tests, that usually points towards diabetes.
What about the in-between zone? Say it's higher than 100 but lower than 126. Is that a cause for concern?
Good question. So those readings, between 100 and 125, that's what we call prediabetes. It's a heads up. Your blood sugar is higher than it should be, but not quite in the diabetic range yet.
So it's like a warning sign.
Yeah, think of it like a yellow light. It means you're at increased risk of developing type 2, but it also means you have a chance to make changes.
Before it potentially becomes full-blown diabetes.
Exactly. It's a window of opportunity.
Okay, so we've got random and fasting blood glucose tests. What about that hemoglobin A1C test you mentioned?
Ah, yes, the A1C. This one's really useful because it gives us a look at your blood sugar control over a longer period, like the past 2 to 3 months.
So it's less about a specific moment in time.
Right. It's like an average. It helps us see the bigger picture, both for diagnosis and for long-term monitoring.
And what are we looking for there in terms of numbers?
A normal A1C is below 5.7%. If it's between 5.7 and 6.4, that points to prediabetes, and 6.5% or higher, again confirmed on 2 separate tests. That's usually a diabetes diagnosis.
Got it. And finally, there's the oral glucose tolerance test. When is that one used?
That one, the OGTT, it's mainly used to diagnose gestational diabetes.
Which happens during pregnancy.
Exactly. It usually goes away after delivery, but it's important to monitor it carefully because it can increase the risk of complications.
For both mom and baby.
Right.
So how does that test actually work?
So you fast overnight, then you drink a sugary solution.
Sounds pretty sweet.
It is. And then we measure your blood sugar levels at specific times over a couple of hours. If it reaches 200 milligrams per deciliter or higher 2 hours after that drink, that usually indicates gestational diabetes.
So all these tests give a pretty thorough picture of how the body is handling blood sugar. What happens when someone actually gets a diabetes diagnosis? What are the treatment options?
Well, the good news is diabetes is manageable. The goal is to keep those blood sugar levels in a healthy range. That helps prevent those long-term complications we talked about earlier.
But the treatment, it depends on the type of diabetes.
It does, yeah.
So for type 1, since the body isn't making insulin, how do you even approach that?
Well, the main treatment for type 1 is insulin therapy. We have to provide it externally since the body can't make it on its own.
Meaning?
Meaning taking insulin regularly, either through injections or an insulin pump.
Now, I've heard there are different types of insulin. Why is that?
It's not one size fits all. Different types work at different speeds and last for different lengths of time. That lets us really fine-tune blood sugar control.
Now, that's interesting. So what are the main types?
We've got rapid-acting insulin that kicks in fast to cover meals. Then there's short-acting, sometimes called regular insulin. That one gives a bit more sustained control. Then you have intermediate-acting for more background coverage. And then finally, long-acting insulin, which acts as a base level throughout the day and night.
So choosing the right type, that depends on the person's needs and what their day looks like.
Exactly. And of course, with type 1, frequent blood sugar monitoring is a must.
How often are we talking?
Multiple times a day, usually.
How's that usually done?
There's the traditional finger prick method using a blood glucose monitor. But there are also continuous glucose monitoring systems, or CGMs. Those are amazing. They provide real-time readings all day and night.
So that takes a lot of the guesswork out.
Definitely makes things easier. Now, you mentioned diet earlier.
It's crucial for type 1 too, right?
Absolutely. It's all about learning to count carbohydrates in food and matching insulin doses to what you eat.
Finding that balance.
Exactly. And a registered dietitian can be super helpful in creating a personalized meal plan.
And what about exercise? Important for everyone, but especially for folks with diabetes.
You bet. Exercise makes the body more sensitive to insulin. Helps it work better.
So it's this whole package, right? Replacing the missing insulin, watching those blood sugar levels, making smart food choices, and staying active. Now, what about type 2? How is that managed differently?
With type 2, lifestyle changes are the cornerstone. That's the foundation. It's all about empowering people to take control of their health.
And that means focusing on diet, exercise, and managing weight.
You got it. A healthy diet is crucial. We're talking about loading up on whole grains, veggies, fruits, lean proteins, and healthy fats, and cutting back on processed foods, sugary drinks, and those bad fats.
So what are some of the less obvious things people should know about diet when it comes to type 2?
Well, portion control is key. Even healthy foods can spike your blood sugar if you eat too much at once.
Makes sense.
And fiber. Don't underestimate the power of fiber.
Fill me in. Why is fiber so important?
Fiber slows down how quickly sugar gets absorbed into your blood. Helps keep things more stable.
And where do you get that good fiber from?
Oh, lots of places. Legumes, berries, whole grains.
Okay, got it. Now, what about weight management? How important is that for type 2?
Weight management is a big deal. Losing even a small amount, like 5 to 10% of your body weight, can really improve blood sugar control. Sometimes it can even put type 2 into remission.
That's pretty amazing. So diet, exercise, and keeping a healthy weight, that all lays the groundwork. But what about medication? When does that enter the picture?
Lifestyle changes are always the first step, no doubt. But medication might be needed too, especially as the condition progresses, or if those blood sugar levels just won't budge.
Okay, so what kinds of medications are we talking about here?
There are oral medications and then injectables.
Can we go into a little more detail about those?
Sure. Metformin, that's often the first medication doctors prescribe for type 2.
And how did that one work?
It's a two-pronged attack. It decreases how much glucose your liver makes, and it also improves how sensitive your cells are to insulin.
So tackling the problem from both sides.
Exactly. Then we have sulfonylureas. Those stimulate the pancreas to pump out more insulin.
Okay, what else?
DPP-4 inhibitors, those help lower blood sugar after meals by increasing the amount of insulin your body releases naturally. And then there are SGLT2 inhibitors. Those work in kidneys.
The kidneys.
Yeah, they help your body get rid of excess glucose through your urine.
So many different ways to approach it. And what about injectable medications? When might those be used?
Injectable meds, those are usually considered when oral medications aren't enough, or if someone has trouble taking pills for whatever reason.
So what are some examples of those?
GLP-1 receptor agonists, those are a common one. They slow down digestion and help your body release the right amount of insulin.
Just when it's needed.
Right. They're pretty smart like that. And then in some cases, if type 2 progresses, insulin therapy might be needed.
So lots of tools in the toolbox. But no matter what medication someone is on, they still need to monitor their blood sugar regularly.
Absolutely. It helps you track your progress, see how your body's responding, and make adjustments as needed with your doctor.
So self-awareness is really key here.
It's about taking ownership of your health.
Which brings us to our next point. Managing diabetes is about more than just meds and numbers. It's a whole lifestyle, right?
It is. It's about making healthy habits part of your everyday life.
So let's get practical. We talked about healthy eating. But is there anything specific people with diabetes should keep in mind?
There are some nuances, yeah. We touched on choosing whole grains, fruits, veggies, lean proteins, healthy fats.
Right.
But there's more to it than that.
Like what?
Become a fiber fanatic.
Fiber fanatic, huh? Why is that so important?
Fiber is amazing for blood sugar control. It slows down how quickly sugar gets absorbed into your bloodstream, helps prevent those big spikes and dips that can make you feel terrible and make managing diabetes harder.
So it's like fiber smooths things out.
Exactly. And just as important as what you eat is how much you eat. Even healthy food can cause problems if you overdo it.
Portion control is key.
Absolutely. Okay, what about staying active?
I know exercise is good for everyone, but are there any types that are especially helpful for people with diabetes?
The best exercise is the one you'll actually do.
Makes sense.
So find something you enjoy. Walking, swimming, dancing, cycling, gardening, whatever it is. And you don't need to be a marathon runner to see benefits.
Little by little adds up.
Exactly. Even short bursts of activity throughout the day can make a difference. Aim for at least 150 minutes of moderate intensity exercise per week.
And I imagine that's good for mental well-being, too.
Absolutely. Exercise is a great stress reliever, and managing stress is huge when it comes to diabetes.
Why is that? What's the connection there?
When you're stressed, your body releases hormones, right, like cortisol.
Right, the stress hormone.
And if you're constantly stressed, those hormones can actually raise your blood sugar levels, makes it harder to manage diabetes.
Adding fuel to the fire.
Exactly. So finding healthy ways to de-stress, that's important.
So what are some good ways to de-stress?
So many things. Meditation, yoga, deep breathing exercises, spending time outdoors, listening to calming music.
Find what works for you.
Exactly. The guide also talks about quitting smoking and limiting alcohol. Those are big ones.
Why are those habits especially harmful for someone with diabetes?
Smoking, that's bad news for everyone. But for people with diabetes, it really increases the risk of complications.
Like what kind of complications?
Heart disease, stroke, nerve damage, poor circulation.
It makes those risks even worse.
Right. And alcohol, it can mess with your blood sugar levels. Plus, it can interact with some diabetes medications in ways we don't want.
So talk to your doctor about what's safe for you.
Always a good idea.
So much good advice here. Really highlights how much people can do to stay on top of their diabetes.
It's empowering, right? It's about taking control.
Speaking of taking control, we touched on some of the potential complications earlier. Even with good management, are there still risks?
There are, and it's important to be aware of them. Because high blood sugar, even if you're doing everything right, it can still damage blood vessels and nerves over time.
So those complications, there's still a possibility.
Unfortunately, yes. But you can reduce the risk big time. And you can delay the onset of those complications.
By managing diabetes effectively.
Exactly. So let's talk about some of those potential complications.
Okay, so what are we talking about?
Well, one of the most serious is cardiovascular disease.
Heart problems, basically.
Right. Heart attacks, strokes, things like that. High blood sugar can damage the lining of your blood vessels, and that makes them more likely to get clogged.
So what can you do to protect yourself?
Well, managing your blood pressure and cholesterol is important, and of course, not smoking and getting regular exercise, those help too.
Okay, and what about nerve damage? We talked about neuropathy before.
Right, neuropathy.
That's a common one, right?
It is. Often starts in the hands and feet. Remember those tingling, numb, or painful sensations we talked about? That's neuropathy. It's basically high blood sugar damaging the nerves.
So why does that happen?
It's the small blood vessels that supply the nerves with nutrients. When those get damaged, the nerves don't get what they need.
So they can't function properly.
Exactly. And it's not just the hands and feet either. Neuropathy can affect other parts of the body too. The digestive system, the urinary tract, even blood vessels.
That sounds really tough. Okay, what about kidney damage? That's another big one we hear about with diabetes.
It is. It's called diabetic nephropathy. Your kidneys filter waste products from your blood. But high blood sugar can damage the tiny filters in your kidneys.
And what happens if those filters get damaged?
Well, if the damage is bad enough, your kidneys can't do their job properly.
Leading to
kidney failure. And that means you might need dialysis or even a kidney transplant.
So taking care of those kidneys is crucial. And we touched on vision problems earlier.
Right. Diabetic retinopathy is a big one. It can lead to vision loss and even blindness.
How does that one work?
It's the high blood sugar damaging the blood vessels in your retina, which is the back of your eye.
Well, I'm seeing a pattern here.
Right. High blood sugar impacts so much.
And skin problems, those are common too, right?
They are. We talked about acanthosis nigricans.
The darkened skin patches.
Right. But high blood sugar can also make you more prone to infections, bacterial and fungal infections, and it can slow down wound healing too.
So cuts and scrapes take longer to heal?
They do. So if you have diabetes, taking good care of your skin is extra important.
So all of these complications sound pretty serious. But the good news is a lot of them can be prevented or at least delayed, right?
That's the key message here. Managing your diabetes well makes a huge difference.
So it's all about reducing that risk as much as possible.
Absolutely.
So to wrap up, what are the main things you want our listeners to remember from today's deep dive?
First off, know what diabetes is and what the warning signs are. Early detection is so important. If you notice any of those symptoms we talked about, get checked out by your doctor. Don't wait.
And if you're already living with diabetes,
take it seriously. Work with your doctor to come up with a plan that works for you.
A plan that includes lifestyle changes, maybe medication, regular monitoring.
Exactly. And don't be afraid to speak up. Ask questions. Advocate for yourself. You're in charge of your health.
Great advice. This has been super informative, and I hope our listeners feel empowered to take control of their health.
Me too. It's not just about numbers and meds. It's about living well with diabetes.
Thanks for joining us for this deep dive into understanding diabetes. We hope you learned a lot, and we wish you all the best on your health journey.